a board-certified hematologist and medical oncologist with a special interest in holistic medicine. She completed her medical school in Iran in 1996, and after practicing general medicine for several years, she moved to the United States in 2001. She completed her subspecialty in hematology and oncology in Louisiana State University and is board certified in internal medicine, medical oncology, and hematology. She was on the faculty at LSU, where she served as the chief gastrointestinal medical oncology of Feist Wheeler Cancer Center. She's been the primary investigator in several clinical trials in LSU and has contributed to several publications. She's been an educator since 1998 and has enjoyed teaching medical students, residents, hematology, and oncology fellows. She and her family moved here to the Houston area late 2013 and currently visits with her patients here at Westchase Clinical Associates. Dr. Armaghany also has special interest in holistic medicine and has done a 2-year extra training through Arizona State University of Integrative Medicine program to assist her patients with complementary and alternative ways of easing cancer treatment related side effects. So if you don't mind welcoming Dr. Tannaz Armaghany.
Hello everyone, thank you so much for coming. After all the introduction and everything that Danny said, it's going to be hard for me to speak now, but I'm going to do my best. So I hope this is not dreadful like Danny said. I'm going to talk about vitamin D deficiency and the risk of cancer. What's the relationship between these two? And please feel free to raise your hand if you have a question in between. I'm fine with that. So how many of you know your vitamin D level? Anybody? Okay. So just 2? Do you all know what the role is? Vitamin D, what does it do in the body? Anybody?
Helps calcium absorb.
Okay. Anything else? Anybody?
Anti-inflammatory as an anti-inflammatory.
Okay. Anybody else? All right. And do you know if vitamin D level changes with where you live?
Yes.
Okay. How's that?
You actually produce vitamin D through the sun. So the more sun you get, the more up north or further south, most people have vitamin D deficiency.
Right. So if you're in the northern states, you have more vitamin deficiency in people than if you're in the southern states. That's great. So you guys know a lot. So just briefly, like you all mentioned, vitamin D role, the most important role of vitamin D is regulating calcium and phosphorus in the blood. So vitamin D is going to do everything it can to bring the calcium of the blood normal. So if your calcium is in your gut, if it's in your bone, it's going to do everything it can to normalize your calcium level in the blood. The other thing that it does, it has a good effect on immune system. And this is published in numerous papers, but one important one is from Hollick in 2005, which actually demonstrated that it boosts your innate immunity and also inhibits autoimmunity. What is autoimmunity? Diabetes, MS, rheumatoid arthritis, these are diseases that are autoimmune diseases. So it has a lot to do with those kind of diseases. Insulin secretion, again, not only it works as an autoimmune mediator, it also affects on the pancreatic cells. And that is done by the vitamin D receptor, and I'm going to talk about that a little bit more. Blood pressure. So this paper, EULA, in 2010, kind of demonstrated that people that were under tanning beds, their vitamin D level was going up and up and up. And guess what? Their blood pressure was going down. So that was demonstrated that way. But then more and more papers came out that showed that vitamin D deficiency is associated with the high blood pressure. Heart failure. It's well known that people that have vitamin D problems, they can have heart failure. So people that have cardiovascular diseases, like they have had an MI or they have peripheral vascular diseases, most of them do have vitamin D deficiency. So you see, vitamin D works in many, many places. For prevention, so what can we do with vitamin D to prevent? So it prevents osteoporosis. So it's pretty common, right? We do DEXA scans for women after 50 years old because we know that osteoporosis is very common. So vitamin D can actually prevent that. Now we know Alzheimer's and aging actually is also associated with vitamin D deficiency. So we want to also prevent that with making sure your vitamin D level is normal. And again, autoimmune conditions like we talked about. But our topic is mostly about cancer. So this diagram here just shows that basically vitamin D is generated in the skin, like you know. That is the most common way of acquiring vitamin D. So in the skin, we have 7-dehydrocholesterol. And when vitamin D, when the sun actually affects our skin, vitamin D3 is what is generated in the skin. But that is not the type that our body can use it to actually affect our organs. So what it has to happen is has to change in 2 different organs. First, it changes in the liver. So the liver actually adds a OH branch to the vitamin D molecule. And that's what we call 25-OH vitamin D3. That is the one that your doctors check it. So if you're talking about, let's check your vitamin D, that's what's going to be checked. That is not the most potent type of vitamin D, but it is the best test that is associated with what you eat. So we know that is what we need to check. But then vitamin D, OH vitamin D, has to also change to another molecule, which is the most potent molecule, which is 125-OH vitamin D. That is the most potent, and that's the one that actually affects all of these organs here. We already talked about it. So we talked about bone. In the intestine, it makes our calcium and phosphorus to be absorbed. In the pancreas, like we talked about, it increases your insulin secretion. And that's where the diabetes the problem comes up. With diabetes, type 1 diabetes, and some of the type 2 diabetes, you have insulin being low here. So vitamin D actually promotes insulin secretion. In the bone marrow, it actually makes your bone marrow start generating good cells. So that's very important there too. This part is the cancer part, which I'm going to expand on that. And you can see some other areas as well. How is it made? We just talked about it. So sunlight, again, affects the molecule 7-dehydrocholesterol, makes D3 and basically in the liver. Not only that, sun, we know we acquire vitamin D through supplements and food as well. But there are different types of vitamin D that we eat through food or supplements, which I'm going to talk about that a little bit more. Vitamin D3 and vitamin D2. So when you go into a supplement store trying to buy a supplement, pay attention to that, because these two are very different and they do not affect the bone and the organs at the same way and the same potency. So, and again, we talked about that. So cholecalciferol is D3. That's what our body is able to produce by the sun. Ergocalciferol is D2. So plants make it, fungus. Actually, the supplements that we see in the stores, those are the supplements that they've put the plant, and then by having sun affecting it, vitamin D2 is what is made. The difference between vitamin D and vitamin D2 and D3 is vitamin D2 only has 40% potency. Okay, so even if you're seeing the same doses, it's not going to have the same effect. So it's kind of a weaker kind of vitamin D. Now this is what exactly you were saying. This is a map which is United States, which this was published actually by WHO investigators. And as you see, this line here shows a latitude. The research shows that anybody is living above this latitude, which is about 37 to 40, they have more vitamin D deficiency. And how's that? So between end of fall, around fall, all the way through spring, vitamin D levels of these people are lower than the southern states. And why is that?
It's because of sun.
Exactly. So the sun, What happens in the winter, in the fall? The sun ray is more oblique. You know, it kind of tries to travel in a longer distance through the atmosphere. So it gets absorbed in the atmosphere. And what happens? It doesn't reach the Earth's surface anymore. So our skin, if you're living in the higher latitudes, our skin is not going to be exposed to sunlight. That's why we get more vitamin D problems there. So people that are living in higher latitude states need to be a little bit more, you know, conscientious about their vitamin D levels than southerns. Do we need to check it? Of course we do. It's not an absolute, you know, line. We are also deficient, but they are more deficient than we are. I've just put this here. This is about Middle East, because I'm from Middle East, and I know that there are several people from Middle East. But this shows the same thing in Middle East. And this is, shows Saudi Arabia and Iran, which if you see the yellow goes to orange to red, the more we go down, the more vitamin deficiency we see. So like in southern states of Iran, although they are very, like we have a lot of sun there, it's like almost like Houston weather, but it's, again, there's a lot of vitamin D deficiency there. It's about less than 10. Less than 10 is extremely deficient. So, rickets. This is an extreme deficiency of vitamin D. We don't see this in the United States. This is usually seen in developing countries and underdeveloped countries, that the mom had vitamin D deficiency, had calcium deficiency, and that the kids are not being supplemented. So this is the extreme clinical manifestation we see with vitamin D deficiency. All right, so what's the connection between cancer and vitamin D? Dr. Garland is the pioneer, is the person that actually, for the first time, showed that there is a connection between vitamin D deficiency and cancer. And he's done years and years of research. Unfortunately, he's died after being sick for a year or so. He died at the age of 60. But he's contributed in this field a lot. And his data shows that there's at least 20 different types of cancer that these cancers are associated with the low vitamin D. Now, I also have to mention that cancer is a disease that there are so many factors involved with it. So we can't really say just having low vitamin D is why someone is getting cancer, but it certainly is contributing to it and making it easier to develop that cancer. So he's held several seminars, like we want to do, and talked about the role of vitamin D and prevention of different cancers. And not only that, he showed that vitamin D deficiency or supplementing vitamin D can prevent so much of interesting and not interesting, but so much of devastating diseases such as diabetes, psoriasis, MS. These are things we don't have a treatment for. So it's better to prevent it and not try to struggle with treating them. Even with fibromyalgia, there's no treatment for this, and a lot of people suffer from it. So it has been 60 years that there's a known link between the sun exposure and cancer. So in 1980s, the first hypothesis was made that there is an association, and this association was seen in laboratory and in animals. In 1985, Dr. Garland, for the first time, published a paper, and it actually talked about the colon cancer relationship. The death because of colon cancer is higher in people that are living in northern states than southern states. So we're happy we're living in southern states. Data is very strong about colon cancer. Almost all the trials that have been done are showing a very good positive relationship. There is suggestion of bladder cancer, gastric cancer, ovarian cancer, uterus cancer, kidney cancer, lymphomas as well. But the data for prostate cancer is not 100% matching with all the data, but with all the studies. But still, there is a lot of people contribute vitamin D to that. Now, I put this here because this is a study done by the government. This is the U.S. Task Force, the U.S. Preventive Service Task Force. These are people that get together and put the guidelines for the country. And as you can see, they have studied the association between vitamin D deficiency and fracture and also cancer. They had 19 trials, and 8 observational studies. So this is the thousands of patients that they've looked at, and they're trying to see if there's a connection there. This is not very clear, but just to give you an idea, if you look at this graph, this is the colon cancer, colorectal cancer risk. So if you go up, your risk is 0 here, over here your risk is 70. This is the concentration of the vitamin D. That's the 25 OH like we talked about. Like any other study, not all studies are going to match with each other. Always when you look at a bunch of studies, there are going to be studies that are negative, positive. That's why they do a pool analysis, which we call it meta-analysis. It's a pool analysis which they put all the data together, and there has to be a very smart statistician to put this together and give us an idea. Okay, is there a risk or is it not? There's no risk. But if you look here, most of these graphs, except this red one right here, at least, if you look, you'll see that as your vitamin D level in the blood is going up, your risk of colon cancer is coming down. Just look at that. And this one, and this one, and this one. So very positive study. But interestingly, there's one study that shows as you go up, as your vitamin D level is going up, let's say you're taking too many vitamin Ds, right? You just want to take too many because you think, oh, well, you know what? More is better. But it's not, because then it's going to give a bad result. It's going to increase your risk of colon cancer. As a matter of fact, it increases the risk of cardiovascular disease too. That's also something we know. So this range is what we want our vitamin D level to be, and that's between 40 to 80. So they concluded that there is a relationship. The lower your vitamin D level is, the higher your risk of colon cancer. And also there's a dose association too. So if your vitamin D level goes up 10 nanomoles, your risk goes down 6%. And in medical terms, in medicine, that's a huge number. 6% is good. So how common is vitamin D deficiency? Let's see. Let's see what you think. 1% of the population, anybody? 1%? Higher? Okay. 5%? Higher? Okay. 10%. Anybody? Takers? No? Higher? Okay. How about 30%?
Yes.
Good. Good. All right. So this is the National Consensus Health Service Data Brief. This is from 2006. This is actually from 2011, but they looked at 5 years. And as you can see, there are two terms: inadequacy, deficiency. There are differences. Okay. It just depends on the cutoff. Some papers say, okay, inadequacy is less than a certain number, deficiency is less than a certain number. Well, we just know that deficiency is much more severely lower than insufficiency. Okay, so if you look at this, you're going to see 24% of our population in the United States is inadequate in vitamin D, and 8% is severely insufficient or deficient. That is 32%. That is 100 million Americans are vitamin D deficient. Okay, that's a very, very huge number. And guess what? It's so easy to fix it. Very easy to fix it. You just have to know about it. Let's look at the death rates of cancer. Okay, this is a USA 2007 death census. Again, the Center of Disease Control and Prevention. Reported in 2010. We had 2.5 million people die in 2010. If you consider life expectancy to be about 80 years, okay? Heart disease was number 1 up there. Guess what? Cancer is number 2. So we have an extremely, extremely common disease. We're dealing with cancer, and it's very, very common. One reason is because people are living longer. Cancer is a disease of age. So we're going to see more and more cancers, okay? Not only that, we are doing screening, so we find more and more cancers, right? But this is the death census. This is not diagnosis. This is not new cases. This is people that have died of cancer. How does cancer develop? Okay, so normal cell, a healthy cell in a normal body, any cell can be a skin cell, can be a liver cell, can be a lung cell, whatever it is. It starts dividing. That's normal, right? But then the cells age, like any of us age. Cells age, and then they have to go away because we want to have new cells, right? So when a cell is injured, it goes away. The body takes it away, and it's a very complicated procedure. What it does, it's called apoptosis. So it's a cell death. The death has a time that it kills itself because it wants to open space for new cells. In cancer cells, that doesn't happen. This thing is not happening anymore. So your cancer cells are going to divide, and it's not going to be controlled by the body. That's what cancer means. Very simple terms, right? So cancer not only does that, it's very, very smart, okay? It will generate its own vessels. The more you have cells, the more you're going to need food. The food can only travel 0.2 micromillimeter from what it is to the cell. Well, the vessels are big, so cancer only has to, what it does, it generates its own network of cells, and that's called angiogenesis, new vessels, right? It not only does that, it also kind of makes its own food. For example, prostate cancer feeds on testosterone, okay? If you block the testosterone in the body, it's going to start producing its own testosterone, and that's amazing, how the cancer survives in the body. So it's smart, and it does that. But then there are internal and external factors that causes cancer. So internal factors that we cannot change are inherited. Hormones, we cannot get rid of estrogen if we don't do any medical intervention. Immune conditions, some people are born having immune deficiencies. And sometimes mutations happen without any factor being involved. It's just genetic mutation happens on its own. And then you have external factors. Tobacco, everybody knows tobacco causes cancer. Or other infectious organisms. For example, HIV, AIDS, people are vulnerable to getting lymphomas and gastric cancers and things like that. Chemicals, people that are working in factories and they are, you know, they have work-related issues using chemicals, they do that, and radiation as well. But let's remember this, you have to be affected by this external disease, external factor, whatever that is, at least for 10 years to have that cancer developing and having a clinical presentation. So if you are like, you know, sitting somewhere and all of a sudden you're getting a chemical like splash on you or something, don't worry, that's not going to cause cancer. But if you are in a factory working with chemicals every year for 10 years, that's what's going to cause cancer. So that's where, you know, the doctors that are dealing with that kind of patient need to be aware of that. So we already talked about that. This slide is just for you to show again that vitamin D 125 is the most potent type. Again, it causes affects our gut because it tells our gut, go ahead and absorb the calcium. I need calcium. Bone, it makes the calcium now sit in the bone if needed. And then immune cells, but then in the tumor microenvironment, this is the cancer cell. What it does, vitamin D is it's going to block the production. It's going to block the proliferation. Proliferation means division. Like if you remember the slide that all these cells were dividing, vitamin D is going to block that. Not only is it going to do that, it's going to block the vessel proliferation. So the vessel that our cancer is trying to make its own food and everything, it's going to block that. So vitamin D really is essential here to prevent not only cancer division, but cancer survival as well. If you remember from biology, who remembers this cell? Right? If you're in your biology, high school? All right, so you have the cell and then you have the nucleus. Inside the nucleus you have, what are these? Chromosomes, right? All right, so on the nucleus, there is a receptor. That's right here. It's called VDR. VDR is vitamin D receptor. Okay, and when you give someone vitamin D or vitamin D is normal, this receptor becomes activated. When it becomes activated, it will send a signal to these genes. And this is like very, I mean, we're looking at this from 50,000 miles. This is a very simplified version of what happens really. But the bottom line is VDR really affects the gene and does all we just talked about. So it prevents this division, prevents all the signals that is needed for that cell to become cancerous and survive. So again, internal and external causes. You have the gene, which is damaged. All this happens, and vitamin D is going to be the one that blocks it right there when you have the problem. Any questions so far? Yes.
So you have vitamin D receptor in all cells?
Yes. You have vitamin D receptor in all cells. Why? Because vitamin D actually is a hormone. And why is it a hormone? Because it's, first of all, produced in the body itself and affects the body on its own. You don't have to have a supplement to have vitamin D. It's a hormone. And hormones always affect all the cells. And vitamin D is one of them. So population is at risk. So we talked about living in higher latitudes. Winter season, we talked about low exposure to sun. How much of sun do you need to have your enough vitamin D a day?
15 minutes.
Like how much? 15 minutes, go just lay in the sun for 15 minutes?
It's 15 minutes naked.
Naked.
Yeah, but that would
That's
be
fun.
hard because everybody wears so much sunscreen, it's in everything, so it blocks that.
Right, so a lot of things are affecting it. But even with some sunblock, even vitamin D can be generated by the sunscreen, okay? So the rule of thumb is if you stand in the sun, and we're talking about not up in Chicago in winter, we're talking about in the middle of the hot season, summer, and you are standing in the middle of the day, which is the hottest time. If you have a size of your palm under the sun for 10 minutes, that's good enough for us to have enough vitamin D for that day, okay? That is assuming your vitamin D level is normal, all right? But our vitamin D level sometimes is in the basement. So we need to first make it normal and then follow that rule, okay? Sunscreen affects it, absolutely. But again, depends on what your SPF is and all that stuff. But you're not going to do sunscreen on your hand, right? Yes.
How do you test for vitamin D levels?
How do you?
How do you
Test.
for vitamin D?
So it's a blood test.
A blood test?
It's very simple blood test. Comes back 3 hours. You have the result, and it's very easy. And also, nothing affects the levels, by the way. When we do blood tests, some of the tests, we say, okay, don't eat this, don't do that, do it in the morning, do it like fasting. You don't have to do any of that. You just take it anytime, okay? Other things, obesity. Why do you think obese people have low vitamin D? Anyone?
They're big, it doesn't absorb.
Mm-hmm. Close. What is that?
They're mostly sedentary and they're indoors. They don't go outside very much and exercise in the sun.
No.
Their diet.
No.
Is it diet?
Mm-mm. All those may be factors, but the main reason. Anybody else? This side is very active. You guys are very quiet here. Yes.
Does that have anything to do with the extra glucose in the fat cells?
Fat cells don't have extra glucose.
What?
Yeah? No.
Liver? Does it have liver and pancreatic?
Does vitamin D affect mitochondria activity?
No. Vitamin D affects the nucleus. That's not the mitochondria. So it's outside of the mitochondria is outside of the nucleus. This is that. So the reason is vitamin D is fat soluble, okay? And when you have a lot of fat in your body, it's going to be absorbed in your fat, so it's not going to be available to your other good cells. Another reason to make sure that you lose weight if you have extra. All right? Other things, steroids, HIV meds, may not be relevant. Gut resections, resect obviously vitamin D doesn't get absorbed. Pigmented skin. Why is that? African Americans, don't have to be African American. I mean, you have, like me, you have a little darker skin, so you're not going to get that much of vitamin D absorption through the sun.
Because of the pigmentation?
That's right. It's going to block it to do what it's supposed to do. So African American people, or heavily pigmented, whatever race they are, they're going to have lower vitamin D. So as a matter of fact, instead of standing in the sun for 10 minutes, guess how much they're going to have to stand in the sun? 1 hour. Okay? So it's pretty effective, right? Elderly people, why are they vitamin D deficient? All the things you guys said. They stay inside, they don't go out, they don't walk, you know, they don't look at their nutrition, nobody takes care of, you know, them sometimes. So a lot of reasons why elderly people don't have enough vitamin D.
Take up for that? I mean, is that something?
Gonna get there. We're getting there. Okay, institutional individuals is self-explanatory, right? They are inside, don't go out, they don't feed them well, all that stuff. Middle Eastern, we just talked about, it has to do with their race, has to do for some genetic factors there. Inherited cases, there are some reasons where you can't, your vitamin D is not absorbed, and if it's absorbed, it's not going to do what it's supposed to do. There's a defect on the VDR receptor, okay? And these are things that are just recently being diagnosed and found. And then exclusive breastfeeding, obviously, you know, somebody's doing that, not feeding themselves with vitamin D, not doing that to their kids, they're going to have that. And vegans. So if you're a vegan, make sure that you're checking your vitamin D and supplementing it. So how do we diagnose and treat it? So like the question that you had, you check your vitamin 25 OH, vitamin D is what is checked. Easy test, very quick, no problem. What the doctors need to think about is why is it low? Okay, so not everybody, so when a patient comes to us, we want to make sure that not only we diagnose it, fix it, we also have to know why it is, because we want to make sure that we are addressing that problem, the underlying reason. If somebody has a gut problem, I don't care how much vitamin D I give them, they're not going to absorb it, right? So I have to come up with another plan. Maybe I have to increase the dose, maybe I have to find another route. Unfortunately, in the United States, we don't have any other route than a pill, but there are some other ways around it. So that needs to be kind of verified. And then you need to supplement it to normalize it. So if your vitamin D level, now just a rule of thumb, 40 to 60 is a good number. So if I see someone's vitamin D level being 50, I'm pretty happy, you know, nobody's going to tell me it's low, nobody's going to tell me it's high, it's normal, right? But if it's like 15, I'm not going to be able to bring that vitamin D up by food. I'm not going to be able to bring it up by fish or any of the good food we're talking about, and not by the over-the-counter vitamin Ds, okay? Over-the-counter vitamin Ds are lower doses, like you all know. You know, you don't have a high dose because it also has some side effects that the physician needs to be monitoring. So we'll make sure that we first normalize it. So the doctor's job here is identify it and then normalize it. And that's a higher dose. We give 50,000 units of vitamin D a week. Some of my patients are here, they would know. And then when you maintain them, right? Then you're good now, we're all good. And then you maintain them. And maintenance is, I don't think all of us are going to be able to go out there and stand in front of the sun and do this every day. So we usually say, okay, you know what, just supplement it with supplements. Because there's a range of supplements, and I'm going to tell you how the range of what is safe is actually very broad. So you can take supplements.
Dr. Armaghany, what is the range?
It's right here, this slide.
Oh, wow.
So, okay. So this is the range. So you need to normalize it. Like I said, high dose pill. So what I do, I give him 50,000 units of vitamin D. I give him for once a week, every week for 8 weeks. Okay. Then I check it again. Not everybody's vitamin D level is going to be what I wanted at 8 weeks. So you check it again. If it's good, fine. If it's not good, you repeat this again. You repeat one more week at least, and then you maintain it. So maintenance dose. This is the Institute of Medicine. Institute of Medicine is again a governmental organization which puts our recommendations together. Like everything else, they are very conservative in the levels that, because it's a public, they have public recommendations, so they don't want to go overboard, okay? IOM actually considers 20 being normal. You cannot find that in any other organization. The American Endocrine Society, which is the one that actually I think everybody should be looking at, those are the people that actually say, okay, this is what you need to do, because they are endocrinologists. They specialize in this thing. And they consider 40, 60 being normal. But even if you go with IOM, the dietary allowance of vitamin D in adults after you normalize is something between 600 and 800 international units a day. Okay? Sometimes people don't want to take a day, so you do it per week. But the maximum allowed dose is 4,000 units a day. So that's pretty broad. So you can do anywhere from 800 to 4,000. Did it answer your question?
Can you get enough from your, or do we usually need the supplements?
You need the supplements.
Since your levels like around 19 and you're taking 4,000 a day, is that enough?
It's not. It's not enough. Vitamin D is consumed a lot because you see how much role it has. It's going to be consumed, so you have to replace and replace and replace. But you most likely you're not going to be able to bring it up. Now, never say never in medicine, right? I never say never, but that's usually going to take either very long or it's never going to normalize. So the safest way and the quickest way is to do this dose. And it's a very, actually 50,000 units is not, I mean, it sounds very high, but it's actually safe. Yes.
You said 50,000, but on that screen it says 4,000.
It says maintenance. We're talking 50,000 is when you have a low level, like she said, 19. You want to bring it up to 40, 60. That's when you give 50,000 units. A week. A week. For 8 weeks, yes. We're going to get there too. We have that. So, sources, okay? Sunlight we talked about. And by the way, are you guys doing that questionnaire? You should do it. And we're not going to grade you or anything, don't worry. It's just going to give you an idea how much you learned from this seminar and if you learned anything. So fortified milk is another source. One other question is, what's the best source? So I want to see how many of you think that fortified milk, what is fortified milk? Fortified milk is we put vitamin D2 in milk. It's not vitamin D3, okay? If you go ahead and consume raw milk, it has a lot of vitamin D. Once we pasteurize it or cook it, whatever, or make some meal with it, it's going to lose all the vitamin D. So we fortify it. Factories do that. And then they put vitamin D2 actually in it. So it's not a very good source for vitamin D. Cheese obviously is the concentrated milk, so you can make your conclusion there. And then fish and cereal. But let me give you a better table here. That gives you a little bit better idea. So what's the best source of vitamin D? It's cod liver oil. It smells, stinks. Nobody likes to drink it. I've never tried it, but if you are against doing supplements and stuff, just do this once a day. You have all your vitamin D you need. It smells bad. But, I mean, it has the highest in all the dietary, all the food, products we have. But again, look at this. Like we think, okay, cow's milk, not much. How many ounces of cow's milk we're going to drink to have 800 or 1,000 international units every day? It's not going to work. That's why we need to do supplements sometimes.
Is that daily?
Well, that's 1 ounce gives you this much. Okay.
Is that something we're supposed to consume daily?
You don't have to consume daily at all. I mean, this is just giving you an idea of if you drink 8 ounces of cow milk, you're going to get 100 units, international units of that a day. Obviously, milk has other reasons why you drink it, right? You're not just drinking it for the vitamin D. You're drinking it for calcium. You're drinking it for other things. Like, for example, salmon, you want omega-3. Salmon has a lot of omega-3 you want to do. But this is just giving you the vitamin D data to give you an idea. Types of vitamin D we talked about. So when you're going out and want to buy vitamin Ds, make sure that you look at the DT to D3 to D2 and make sure that, vegans usually like the vitamin D2 because it's from plants versus D3 is from other, meat products maybe. Depends on how they make it. It's made in different ways. So they are comfortable with the D2 part. And they are very similar in structure, just to let you know. I'm not a biochemist. But just to let you know, it's very, very similar. There's just one extra methyl group there that is making a vitamin D3 become vitamin D2. So the conclusion we have is vitamin D deficiency is very common. And it affects many organs. It's a hormone. Think about it as a hormone. You want to replace your hormone that is going to affect almost all of your organs. Cancer risk goes up with low vitamin D levels. So I don't care if prostate cancer didn't show it's in the study. I'm going to make sure that my my patient's vitamin D level with prostate cancer is normal because it scientifically makes sense and studies have done. I'm not going to wait 10 more years for someone to tell me it works. I'm just going to do it because it has other effects on other organs as well. And make sure you ask your doctor to check it. Some people have so many other medical problems doctors trying to go through, and this is sometimes overlooked. So make sure you ask your doctor to do that. And I'm always for supplement is the last. So make sure that you take your food, do all the things that you think has enough vitamin D. At the last, if you see that you don't have enough going on, you're not cooking the right thing, you're not happy with what you ate, consider yourself taking the supplement. And then take control of your own health by doing all this. All right, any questions?
How often do we need to check our vitamin D level?
I would say twice a year.
Okay.
Because twice a year talking about winter and summer. Usually in the summertime you have enough good vitamin D, so probably every 6 months would be good enough.
But with those that they had a low vitamin D deficiency, and then you suggest the supplement, again they have to check it twice a year, or do you do it more often, to make sure that they're normalized, and then after that, you keep them in a maintenance program.
That's right. So if you have a low vitamin D level, let's say someone's vitamin D is 15, you check it, you do 8 weeks of vitamin D, you check it after.
Okay.
And then if it's not where you want it again, you do 1 more week and then you check it after. Once it levels out, you check it once maybe every 3 months, like you do one more at 3 months to make sure. Patients tell me they are taking, but they're really not taking, or they're not absorbing, or they're, for some reason it's overused in their body. So one more at least 3 months after that, once normalized. But then I see that things are leveled out. I just do it once every six months. Yes.
Do you recommend checking vitamin D levels for the kid, like teenagers?
I would do it, yeah. The study that actually I showed, that showed 100 million people, they were people above 1 year old. So kids can have it, definitely.
And can vitamin D react with any other vitamin if you take like a vitamin D and several other supplements?
It doesn't. Because as you see in multivitamins, you have the vitamin D and A and zinc and selenium, and then you have vitamin Bs, so it does not. Yes.
What about patients that have diabetes?
Mm-hmm.
Is their vitamin D deficiency much lower, or is it more harder to bring it back up?
So you're saying, looking at the population of diabetic people that have vitamin D, how often we see that?
Right.
I don't know that. I don't know. I'm sure there has been people that have studied it, looking at a population of diabetic people and then checking their vitamin D. This is what your question is?
Right.
How often we see that? I'm sure that there has been some studies, but we can look it up. Yeah, but if you have diabetes, I would recommend diabetics should check their vitamin D. Not because it's because of vitamin D you have diabetes, but it's contributing to the insulin secretion. We just talked about it. It contributes to the secretion. So optimize everything before we, say, okay, this is your destiny. There are so many things we can do to actually decrease the chances of these diseases. Okay? Anybody else? All right. Well, thank you so much. Thank you very much.